Um, my name is Cameron Ripley. I'm the CEO and founder here at Community Boost. And welcome to today's, Fireside Chat, we're calling it here, where a safe reopening, how these nonprofits avoided the biggest COVID catastrophes. On behalf of Community Boost, we are so excited to just bring together many nonprofits to really have this discussion and talk through a lot of the challenges and learnings when it comes to navigating and really persevering through these times of, reopening, partial reopening, health screenings, processes, and systems. We want to allow for plenty of Q&A today. Without further ado, I want to go ahead and introduce Jessa Costanzo from the feverfree.ai team, who is really co-moderating today's session and is kind of running point from the Fever Free team. Jessa, you want to go ahead and introduce yourself?
Yeah, thank you so much for having us today. What I'd love to do is really show you a quick overview of Fever Free, and then also go over a really quick demo, and then get to the best part of today with introducing our amazing panelists who have also been using Fever Free as part of their screening process. So just want to say thank you again. Information sharing is so key right now. So I'm really excited to kind of give you a little bit more information on Fever Free. Let me go ahead and just share my screen here. I think it'll let me share my screen. There we go. Can you see my screen okay?
Yep.
Awesome. All right, now it's all queued up. So I would love to tell you, just as a high level, Fever Free is basically a mobile app and technology platform for organizations to conduct virtual and remote health screenings, but before they ever arrive at a location. And our technology does not rely on any self-report. I'll show you it later in a little bit, but I'm guessing you guys are probably thinking, how did a childcare company, WeCare, end up creating an artificial intelligence mobile app for health screenings? So I'd love to kind of take you on a quick story of how that actually happened. So WeCare is the nation's largest network of childcare providers. And really this just came from a place of trust and safety always being a cornerstone of ours. But back in January, so if I take you a little bit back in time, if you guys remember January, WeCare was actually in the height of our growth. We were adding more providers and families onto our platform than the entire previous months. But we were also watching everything that was going on with COVID. And we were watching the news. Oh, did it freeze? Yeah. So we knew how important health screenings were. We saw that it was part of the response. But we also knew that in order to conduct health screenings and doing these temperature checks, that it violated the first principle, which was to socially distance and keep people 6 to 10 feet away. But you had to get so close to people in order to actually conduct them. So we were like, this doesn't really make sense. We need to solve this. If it should come to the States, we really wanted to be prepared and just do whatever it takes to help keep our providers and families safe. We also had some unique challenges. So being in childcare, we wanted to make sure that we could enforce accountability. We know how innocent parents are, just being very busy. They're trying to rush out the door. They got their kids crying. We wanted to make sure they couldn't just type into a system any temperature that they were remembering just out of sheer I gotta get out the door. We wanted to make sure that we could enforce accountability. We also, the same side with providers, wanted to make sure that when parents were looking for childcare, they knew for sure that these providers were doing these health checks. It wasn't self-report. So what we actually did is, thankfully, we had a bunch of tooling already built in our childcare WeCare app, but we essentially hijacked our own internal tools, and we allowed for providers to submit temperature checks of themselves live on video to really enforce that accountability. And what that ended up doing was we created fever-free zones. And again, this is all way back before COVID hit, so I'm taking you on a time warp. But we really wanted to make sure that peace of mind was a big thing for us. We also had another unique challenge. So if you're looking at the numbers here, if we had, 3,000 locations and we've got 12 families at each one, that was about 36,000 health checks we were going to need to do. And the unique thing with that is all these kids needed to be dropped off at the same time, roughly. So that would mean that we needed to process 300 hours of work within, 2-hour window. So what we decided to do, instead of hiring a massive team, of course, is to add in artificial intelligence and machine learning so that we could actually process a large amount of temperature checks. What this did, interestingly too, though, was create the most private and compliant, least invasive way on users. And switched out again. Not moving, is it? There we go. As we all know, it did come to the States. And so that was back in March. And as it started to pick up in the media, we had a lot of our providers call in and want to close at first. But when we gave them this tool, 84% of the time they would actually decide to remain open. And they took oaths to actually stay open and help with the essential workers. And that sparked a lot of partnerships with government, cities, and states. So not only were we servicing the highest, most at risk for spread and population, but what we had was we were able to show that we were successfully not having any spread in our childcare locations. To this day, we still haven't had any that were using it had to shut down due to any COVID spread. And in those partnerships with the governments and the cities, they would always ask, though, I need you to recreate this because we got to keep hospitals safe. We've got to keep our schools safe. We've got to keep our firefighters safe. But they didn't want to send them, of course, to our childcare app. So that's exactly what we did, is we created a whole new freestanding tool. Since then, it's evolved a ton of times, and we've been supporting basically every sector of the economy. It's been an incredible journey. But really at the core, we've been supporting nonprofits and educational institutions as well, and first responders. And now it's being used all over, but that's basically the high level story of how it came about. What I'd love to do is just quickly, rather than even trying to explain how it works, is just switch my screens and just do a really quick screen share of how it works live and in action. All right, so I gotta quickly toggle out of the desktop now and then onto the mobile phone sharing. So I have a special view here, so I'm gonna be able to show you a good health check and a bad health check really fast. Let me know when you can see my screen, okay? I'm gonna be becoming Wonder Woman to start, and I'm gonna be showing you a good health check. So Wonder Woman here belongs to the superhero and she would get a notification via text message and in-app. I have those turned off for right now though, since we're going really quickly. But she's able to open her app and it opens right up, and she's able to tap Submit Health Check and take her temperature live on camera. And it does work with any digital thermometer. Social equity is huge to us, but also scalability. We want to help the most amount of people in the quickest time. Up next is my Superhero Academy's customized screen. So this is what they've set up for me to be able to report back. And I'm going to show you a good health check, so I'm not logging any symptoms right now. Now what's happening is it's going through. The artificial intelligence is checking to make sure that Wonder Woman hear me, took my temperature live on camera, I was using the device, and that reading of it. And it usually takes anywhere, it already went through, so never mind, I'm not even going to tell you that part, but it usually takes 2 to 20 seconds. And what's really amazing is when I go now to go to work at Superhero Academy, I'm able to quickly tap this and visually display my clearance badge. And so now someone knows from 6 to 15 feet away that I am clear. So no one has to get into contact with me. And what a lot of organizations do is actually set up different destinations. And some are calling this the fast track or the cleared lane. Awesome. Before I do that, now I'm going to switch over and show you a bad check really quick because I want you to see how powerful this really is. I'm going to become the Joker here. And I'm still just showing you the first user type, which is someone that should be able to submit a health check but should not see anyone else's health statuses. This is not a health manager or an organization owner. So the Joker here, he's able to tap because he's in a family with Harley Quinn. So he's able to tap himself, and then he's going to try and pretend to take his temperature and instead submit in. And I'm showing you this because I want you to see how powerful this is. So next up, I'm not going to log any symptoms because I want you to see the artificial intelligence. And I go ahead and hit no symptoms. And again, it'll take anywhere from 2 to 20 seconds when it's someone what we call sometimes like a bad apple or trying to get past the system. We wanted to make sure we created the most foolproof option to really minimize risk by keeping people separate, but also making sure that we could enforce accountability. And if you see it already went through and it says that I also submitted a fraudulent video, normally there would be a text message and all kinds of amazing things. For the sake of time, I'm actually not going to dive into all the other incredible features that we have and probably the things that a lot of questions around organization owners. There's all kinds of amazing tools from reports to, how you're able to see who is passed and who is not. But I want to be able to go ahead and flip it back over and get to the meat of this, which is going ahead to do the panelist. So thank you so much for being able for me to quickly show that. And I'd love to now be able to introduce the more important stars of the show. So we have Richard from Eagleville Hospital here. We also have Sonia from the Bullock Garden Project. And we also have Lang from Orange County Rape Crisis Center. So welcome to the panel. I'd love for each, starting with Richard first, to be able to give us a quick introduction of your nonprofit, your role, and really what the biggest initial struggle was when you were thinking about how you were going to form your COVID response plan to keep your community safe. I'll pass it to you, Richard.
All right, thank you, Jessa. My name is Richard Mitchell. I work for Eagleville Hospital. We're a 305-bed behavioral health hospital outside of Philadelphia, Pennsylvania. And the biggest issue we came across is we have 3 shifts of staff, 7 days a week. We have approximately 12 buildings on campus with multiple entrances. So, just trying to corral everyone to like 1 or 2 entrance points to do manual health screening, that was going to be a big issue with us. Even trying to, at our main entrance, doing it, we initially tried to take temperatures as they were coming on the campus through their vehicle. And because of the cold weather back in March, that just didn't work at all. So those were some of the problems we encountered at the very beginning.
Amazing. Well, thank you for giving that introduction and also telling us about that. I'd love to pass it to Sonia now.
Hi. So my name's Sonia Harris. I am the CEO of the Bullock Garden Project Incorporated. We are located in South Jersey. And COVID hit around our busy time. We help families and schools and organizations. We're a nonprofit, and we help grow gardens. And our focus is on schools and organizations that help large populations of people with either food insecurity, food apartheid, who've been affected by food apartheid, but also have organizations that have high numbers of children with special needs. So when COVID hit in February, and New Jersey was one of the major hotspots, we still had schools and organizations that we needed to help. And we jumped further in to help feed people. We saw that farms were tilling crops under. We saw that people really needed food. So it actually was a call of action to us to step up. And we needed to do this safely. Also, in the midst of this, we started a school for children that the virtual learning was not working, and we needed to be in person. So we have a staff of, we have 10 board members, And we have students who work for us from Rowan University. So we have 4 students from Rowan University currently. And we have volunteers. And we needed to make sure everyone was safe. And if you are working in the summer, it is very hard to garden with a mask on. We sometimes it's hard to social distance. So there's a mixture of having your mask on and having your mask maybe partially off, but using fever free made a huge difference for how we were able to continue. So that's my introduction. I can tell more later.
Love to pass it to Lang now.
Good morning or good afternoon, depending on where you are. My name is Lang. I am the Business and Finance Manager of Orange County Rape Crisis Center. We are an organization that supports survivors and secondary survivors of sexual assault and sexual violence. And we have a large program that provides outreach, education within the school system, and therapy, as well as online crisis response. When COVID hit, our local government shut down as of March 16th. And our biggest hurdle was kind of executing all of our programs and how to still function and give access to our clients and the community. And then thinking about reopening, what formula do we follow? Whose guidance do we decide and still remain compliant in some way and true to our community and our staff members?
Beautiful. Well, I first just want to say thank you. I mean, it's honestly inspiring to hear how the 3 of you doubled down during, as organizations to live into mission and continue to support beneficiaries, where we often had more beneficiaries than even in normal times. And so it's exciting. And Jess, I love that, as it's a social entrepreneur in me, to just hear your story of how you pivoted really neat technology to help so many amazing causes. So thank you for all the work you all do. Richard, I'd love to just dive in a little deeper too. As a hospital, health and safety is clearly of the utmost importance, but can you just, you talked a little bit about the kind of high level, the challenges and your plans for screening and processes, but can you dive into a little bit more of that and some of the biggest takeaways and learnings that your team has, figured out?
So, as an organization in Pennsylvania, we have to report to the Pennsylvania Department of Health, and specifically they wanted to see our log files of staff temperatures and staff health screenings. Since March, we've been trying to do most of that on paper, and it's just been overwhelmingly difficult for compliance because sometimes staff they don't remember, or they've got so many other things on their mind besides their normal jobs of taking care of some very sick patients. Then they're in the middle of COVID too. So they're worried about their families going back home at night. They're worried about if they're going to get sick themselves. So, remembering to take their temperature and doing a health screening before they start their day, it just wasn't working out all that well. And in order to report to the Department of Health, it was just very difficult to collect 12 different, and most of our locations have multiple units. So we had at least 24 different paper logs that we were collating and trying to report data. And Fever Free, with its ability to do all that, first of all, we're able to have staff self-screen before they even come into the office. So into the campus. So that prevents anyone who might be sick from even coming on the campus, infecting their coworkers or infecting our patients here. And then the other thing is the ability to just one data point within Fever Free to be able to pull all that data down and then report that data to Department of Health made it very time savings effort for us. So we've seen, it's funny you brought it up, Karen, but like for most of us, and I'm not promoting any specific cell phone technology here, but when I turn my phone on in the morning, and what we found with staff, they turn their phone on, and Siri just suggests Fever-Free is the first app every day for most people. So it's not hard to use. It's quick for everybody, and it's been very successful for us.
That's definitely insightful. Sonia, can you tell us a little bit about your reopening experience? Sounds like you even adjusted your mission a little bit too to serve the community more. So it sounds like there's a lot of community engagement, but also, how did like staff from your organization and size of organization, how do they react to the protocols you're putting into place as well?
Oh, we all were on board immediately. We were all on board with this because, like I said, instead of this being something where we shut down, we ramped up and we became in more demand for helping teach people how to grow food, in seed delivery, in helping people have access to soil and delivering fresh food. So we had to put something in place. And it was very easy when this came up and we found Fever-Free and just went across our entire organization, just asked all of our board members every day, whenever you are working on anything involving BGP, as we call it, please just log in, do your temp. We want everyone to be in this habit. So this is something that we adopted just across the board, even though we're not in person every day. We just want it to be in the habit. And then with having a school, if you don't mind me sharing my screen for a quick second, with opening this little school, what we had to do, if I can find it, because now I don't see it.
So you should be able to do it now.
Like we were able to, make sure that the kids were safe. Let's see if I can. Of course, we had something like this because we want to have this posted, but this is just the norm. And this became the norm for working with children. We knew we needed to have a safe space for anything that we did with the kids. We were asking for this commitment from all of our board members, all of our volunteers, all of our staff. So, this is just the norm. When you come in, you have to be safe. It works very easily, even if we're out. I mean, you have this little thing, and if we're out gardening and it adjusts to the outdoor temp and someone else comes up, it's very easy to just take a temperature, make sure everyone is safe, make sure everyone is okay, make sure that we're tracking temperatures throughout the day. It has allowed us to actually increase our work and increase our reach. So we have been able to do a lot across the local area. And like I said, especially New Jersey, which was a hot zone for the pandemic, we took a lot of extra precautions. And I mean, one of the stories that I tell, and then I'll be done, because I can rave about Fever-Free. When we started very early on and we were testing it and trying to learn and see, one of our people had, her allergies were bothering her. She put in that she had a sore throat. She had taken her temp, but put that she had a sore throat. Immediately got the flag, and I got a call. I had Maya call me to say one of your staff did not pass. And I immediately looked at the phone and was like, wow, this is incredible. So to have that kind of care from an organization, from a company, really means a lot to us, because it's not just us caring. We really feel that you care about all of us. So we're very thankful for Fever-Free, and we are Fever-Free across our entire organization.
It's cool. It sounds like it saves so much time too, that you can then, as executive director, CEO, like focus on the mission, what you ultimately should be most focused
Right.
on. Lang, what would you say some of the most difficult parts of, forming your own organization's reopening screening plans have been? Has there, been any just big unexpected challenges?
Our biggest challenge, as I mentioned before, was what guidelines do we use to reopen? Whether it's the CDC guidelines, local government, and also we are located in Chapel Hill, North Carolina. We're a college town. There were a couple spikes here. Just a very big community base here. So we decided on a 4-step process. First, we wanted to make sure that the stay-at-home order was lifted. We wanted to make sure that there was a sustained downward trend in new cases, and that we could provide adequate PPE and health screenings for our staff and our clients. And also that staff would feel comfortable returning back to the work environment. The good thing about the Fever Free app, not only for staff, but for clients where we had to pivot to appointment only, they are still provided with privacy in the app. That's a huge thing for us. And when you use the app, you can remain, it allows us to be anonymous. You can put any name you want. We know who you are, but no one else is able to look at the app and see that, this coworker or that coworker signed in or passed or failed, or so it provided a security and a safety for our clients. We have a process where when you come into the office, there is a contactless thermometer set up and a phone for someone to screen themselves, and then we disinfect those devices so that there's no close range between staff members and clients. So it allowed us to still be able to provide services to all of our clients where we were really struggling with what that would look like for clients who needed to be in person. Some of the services could be virtual, but intakes could not. You physically have to come into the office. So that was a hurdle that we had to overcome, and the Fever Free app allowed us to do so.
So to make sure I have that right, you basically had a device for specific clients, or like a device for clients, and then you would just clean that, but you kind of knew that that was your client account and you could monitor.
And then each staff member has their own where they get the alert in the morning and they can check themselves in.
Excellent.
Thank you so much for sharing all of that. It's been really impactful to hear it firsthand from you guys as well. I'd love to know, just as organization leaders, everyone really looks to you as the one that has all of the information, even though we're living in a time that it's constantly changing every day, new regulations, having to stay on top of that. But then also on top of that, you're looked to make sure that you're the one that's enforcing the accountability or the health screening protocol. Have any of you had any challenges where someone may have reported that they had symptoms and then having to uphold the accuracy because maybe they said then, it was just allergies, or, oh, that was an accident? And I'd love to hear kind of what your guys' protocols are in those scenarios.
So Jessa, I'll take that question first, if you don't mind. One of the things early on when we were looking at Fever Free was, and I wasn't trying to be a bad boy, but I wanted to see if I could fool the system. So, I'm dipping my thermometer in hot water and holding it up to my camera phone. And, I went into work that day, and Maya from Fever Free reaches out to me, and she's starting to ask me stuff. And I'm like, Maya, it didn't process my, my health check in the morning. She said, oh, Richard, we got it. I wanted to, and we were very new as a customer evaluating it. She told me exactly what happened and that it was a fraudulent video, et cetera. And I was really, really surprised me that the AI behind the scenes is that powerful to do that. So, one of the things I did want to see is, so I wanted to see how staff, we were evaluating it. We have about 10 or 15 staff looking at it. And so one day I was able to take some hot water in my mouth, put my thermometer in, was able to elevate my temperature. The app reported me as having symptoms, and I also said that I had a cough. And so I showed up to work that morning, and within 20 minutes, maybe 3 or 4 of my coworkers saw me, and they're all saying, you didn't pass this morning. What are you doing here at work? So it was just amazing to see how many people were watching the app to make sure that everyone was doing their health screenings in the morning. The one problem we have is that we only did that during the testing. We were locking it down for our rollout to our entire staff because of confidentiality issues. But what we are going to be able to do is through the web app, be able to see everyone that has done their health screening, and through our time management system, ADP, we'll have an administrator going through both systems, looking at fever-free and who's clocked in, just to make sure that everyone who is here on site has done their their health screening. So it's just, it's really worked out very well for us.
Awesome. Yeah, I wanted to also help clarify too. We've been supporting so many different industries and all with different regulations and needs. For example, with hospitals needing to actually have the specific temperatures versus if you're having with schools and you're having FERPA and HIPAA compliance and all of those. So we've been really on top of making sure that we're supporting not only the organization to make sure that they're fully compliant and also the users, but it's been built in such a flexible way to also be able to help support that. So it's really awesome to hear though, as well, that you're able to, enforce that accountability that way. I'd love to also now kind of look at what you guys did in your process when you were evaluating different health screening tools, what you thought about in terms of time or cost, or was it really just easing into making it easier to conduct these health screenings? Was it the reduce of liability with exposure? What was it really that you were taking into account when you were evaluating different options?
I think for our organization, privacy was the most important for us. So we wanted to make sure that there was an application that would allow clients to keep their personal identifiable information just away. No reporting. Any staff that wasn't on a need-to-know basis would not have access to that information, and giving them that peace of mind that we could comfortably do so. This app allowed us to be able to do that.
For us, and I have to keep going back to, New Jersey was a big hotspot. I know of people who contracted it and were okay, and people who contracted it and passed away. And that was all going on, with everything. And we just needed to keep everyone safe. And when this came around, it was like, oh my gosh, we can do this. And then we were able, as a small nonprofit, and we were economically affected by the shutdown, because we were one of the first states to do a complete shutdown, And because we were in the ag industry, we were able to still be essential and go out and try and help people. However, we had no funding. We had some partnerships that we were supposed to have, that would have helped us and put money in the bank, and then everything cut and people's jobs cut. So when we were looking at pricing and knowing we needed to have people safe, and we were trying to figure out, like, how can we cover all of our people, Fever Free actually worked with us. And, we said what we could do. And we're so appreciative that that happened, because we had to be essential in feeding people, and just being able to know that we were not spreading, to be able to know that we weren't taking things home to our families, being able to feel secure in that we had something that worked and kept everyone safe. So, so critical. And now that we're working with our children, and we even had a little panic last week because we had a couple kids who had fevers. They were low, but because we had the app, we were able to immediately contain it. And everyone, like, we require COVID checks constantly, every few weeks. So it had kind of happened at the same time we were all being checked. And then we sent a message to our entire organization, and everyone was extra diligent. So yes, you have the privacy, but as the CEO, I can also have that contact with people who, are saying, hey, I'm concerned about this, or there's a fever. And I'm like, just go into the app, check everything through the app. And, if you fail on one part, it's okay, because we just want to keep everyone safe. So the AI has been incredible. Incredible.
Awesome. It was funny, you guys were reminding me, like when you were talking about privacy. Privacy is huge to us. We're living in such an interesting time right now where it's hard, because as organization leaders, you have to make sure that you're protecting, everyone and the whole community, but then you're also needing to make sure you uphold the rights that each individual has as well. And so that health data and making sure that it's private is so important. Another thing on that, it was funny when we first did this, we actually weren't sure about adoption rates. Like, would people do this at home? And, why are they going to do it at home? But what we found was people would actually start telling us, after the fact, they're like, we love it so much more at home. It's that anxiety. They have test taking anxiety. They were worried about, what are they going to do if everyone sees me and I fail in front of everyone? And I always joke when I'm trying to tell everyone about, it's kind of like when you're at the grocery store and you sneeze and you're like, no, I'm sorry. Or it's that sort of anxiety that people have then, and also to do it in front of others, they're having that same anxiety. So really about giving them the peace of mind and the privacy to do it at home has actually helped with compliance, with actually doing the health screenings that are keeping everyone safe.
If you don't mind me interrupting for a second, I'm sorry. I just wanted to say what's also nice is when you have people in the same household and being able to have that check some of these new features from one household. Absolutely. That's a game changer. That is a game changer. So.
Just to answer your question earlier, what you asked about customization, I think we actually went with like the CDC guidelines, the Pennsylvania Department of Health. It was 100.4. We're able to set that in the app. We did customize the symptoms list so that it was specific to Eagleville Hospital. And the one thing we really like, because we are 3 shifts, 7 days a week, is the notification settings that each person can set. So like for me, I'm a 7 to 5 guy. So I'm doing my my notification at 6:30 in the morning. But nurses who are working 3 different shifts, they could set it if they're coming in at 11 p.m. at night. They're setting their notification for 10:30. So it's very user-friendly, the application.
Awesome. I mean, I feel free, we'd love to open it up to any of the attendees. If you have questions, feel free to post them in the chat or the Q&A. And I just have a question for the panel as well. I'm curious how, you all, I mean, some of you just never really even shut down, right? Like you needed to continue to serve, and this tool has helped you. How are you planning, how is like the next Q4? How is early 2021 planning? Are you thinking about, vaccine scenarios? Just how is that all coming into play? And as you continue to serve in the mission?
So Cameron, can I answer first?
Sure.
What we've done is up until now, we've been very lax with staff, getting them used to taking their temperatures and, their health screenings. But, from a human resources department, they're going to really start focusing and incentivizing staff to complete the health screenings without a whole lot of nudging. And the other thing here at Eagleville, and I'm sure it happened nationwide, the availability of PPE early on and during the pandemic was really hard to acquire. I think Eagleville we positioned ourselves that we feel like we can get through the winter now up until next year when there could be some relief from this. But so right now we mandate, and it's funny because I have my whole collection here. We mandate an N95 if we go to a unit. If we're not on a unit, depending on where we are, we may have like a KN95 or even just a standard loop mask. And then when we come in and out and go home, we can wear our cloth mask when we want. So we're really tightening it down where, when you come on campus, it's mandatory that you have a face covering, and things like gaiters, they're just not permitted. And if we have somebody who wants to visit us and they just don't feel like they need to abide compliant with us, our rules, will just not permit them access to our campus. And the same thing with visitors are also required to go to our infection control office and have fever-free record their health screening. So, if any of those protocols are not followed, then we just don't permit people on campus.
100%. You have to. This is the new norm. This is a new requirement. This is something that we are going to keep. The work that we all do here is so important. So we have to make sure that we're always safe. And what I love, our kids automatically know, like they'll say, at lunchtime is when we do the second temp check. And they'll say, "You didn't take my temp." I'm like, "I'm coming. I'm on my way." So this is definitely something that is going to be a constant, even in a time when there's not a pandemic. This just keeps everyone safe. And the same, just like you, Richard, like if you don't want to do this, or you decide that, it's not for you, then you cannot be part of us. We have the Fever-Free banner on our nonprofit website and on our school website. So parents can see it and they know that this is something that we do, and we are serious about it. We are very serious about it. So yeah, this is just going to be how this is.
Oh, sorry, go ahead, Blaine.
Oh, I was going to say, for OCRCC, we have all of the requirements to make an appointment and what's required to come into the office. Everyone is required to wear face masks. We have hand sanitizing stations, as well as a accessible restroom for hand washing, and just kind of cleansing the office every hour. However, we can't deny access. So in those situations where someone may say, "Hey, I don't feel comfortable with you taking my temperature. I don't want to wear a mask," this has actually allowed us to see deficiencies and opportunities in the organization and the opportunity to invest in technology. So if you do not want to wear a mask or go by our guidelines, we'll set something up virtually with you, but we can't deny any client access to services. Part of the investment in technology was Fever-Free as well, and try to make that, it is mandatory for our staff and clients. But if they refuse, then we have an alternative set up as well.
I love that. I think, we've, on the marketing front at Community Boost, we've talked a lot about how the pandemic has also really just accelerated what's written on the wall for a lot of organizations. Your ability to embrace technology is critical to, really continuing to grow and sustain. And navigate what is just an ever faster moving future. So same thing on the operational delivery front, and it's pretty cool that this technology has really helped you all just continue to serve the mission to this type of capacity. Question from Matt. I'll ask that in 1 second, but I just have a question. Like, if you could go back in time, what would you tell yourself or your leadership team, when you first started rolling this out? Like, what did you not know that would have helped you, be more successful and prevent any, headaches? Go ahead, Richard.
All right, so one of the things, we have 500 employees here, and we all hold different jobs, and we're all at different levels of a socioeconomic scale. And we had staff who didn't have digital thermometers, so we supplied them. We had staff who actually, and it's funny, you still have staff people who don't have smartphones. So we created processes where they could come to an office. Either their supervisor could use fever-free and check them in, or our infection control nurse. So we tried to take into account anyone's needs. It's mandatory that they do the health screening, but we would make adjustments to the processes to meet anyone's needs.
Social equity is huge. That's actually why we built the technology the way we did. We didn't want it to have any sort of supply constraints. We saw what happened with toilet paper, so we didn't want any specific thermometer to be where we had it to only work with that. But also, social equity is so important right now, and making sure that it can work with $5 underneath the tongue one all the way up to the fancy ones. So social equity is really important. We also have the in-person screenings so that you're able to have that as well. It's really important to make sure that you have as airtight plan as you can, so that you can also make sure you have all the checks for regardless the background.
That in-person screening is also so important because we can carry our thermometer with us, and if we're out, and about doing our work, we can immediately just take a temp right there and ask the question. So it's very important for us, and it does help with the social equity. Because the people we work with, a lot of them, we've had people who don't have thermometers at home. So this does help.
Is there anything you would have told yourself to, right, like you could go back in time to prevent any issues?
I think that because there's so much that was unknown at the time, I was a little fearful of leadership and what that would look like and making the wrong decision. I would say, because this is new for all of us, not to be afraid to kind of trust your instincts and trial and error. That's kind of how this works, right? And try things, and if they don't work, try something else until you find a system that does work.
Excellent. Well, Jessa, do you have any final thoughts or advice for the audience?
I'd love to actually answer the question that was brought up in the Q&A, if we're able to do that.
Yeah, go ahead. I can read it for you. So Matt asked, do you think health screenings will exist beyond COVID? Have you seen reduction in overall sickness by implementing these practices?
I'd love to hear from the panelists directly, but what's been the most interesting for me is in the very beginning, that question got posed a lot, and people would say, is this only for COVID right now? But we've really seen a transition, and it's being looked at now like how 9/11 changed the travel industry, that this pandemic has really changed the way we look at how sickness impacts communities. I don't think anyone wants to live through another pandemic. So I would definitely want to make sure that now we're not spreading sickness. Another really interesting thing is seeing the shift from, even in the workplaces, before COVID, it was almost like a badge of honor to go to work sick. You were like, I'm here and I'm sick, but that is completely the opposite now. That's so far beyond. Now it's almost, that's a prerequisite to show that you are healthy enough to go to work. So that's been a really interesting shift. And then also another one is recently people will start talking about the flu season, and some people are calling it all kinds of fun names now. We hear like some interesting non-marketing names like twin-demics and all kinds of stuff, but really about how now they're excited to catch that sickness as well. It's not just about COVID. No one wants to get the flu either. Like, no one wants to get that. So it's really just about making sure that we don't spread sickness anymore to one another.
I will add to that. I've been fortunate enough to not encounter anyone with a failed screening. However, I had someone that said, oh, you know, I'm not feeling very well. I'm going to go to urgent care. And they ended up being diagnosed with conjunctivitis. And they said, oh, well, I can still come in. I said, absolutely not, because you are still super contagious. So it helps with more than just COVID. Like, it makes you very aware, like you mentioned, Jessa, of, yeah, if you're sick, stay home. You don't need to prove anything to anyone. It's okay to take a day of rest. And I think we're all learning that through this pandemic as well.
Yeah, I'd like to just quickly add to that. I was a teacher for 25 years. I retired last year so I could run the organization. I can tell you as a special educator that I would drag myself into school all the time. I stayed sick because parents would send their children to school sick. I mean, I remember parents sending them and saying, they don't feel good, but I gave them some Tylenol. It should last for a few hours, but I have to go to work. And, you know, my doctor was always saying, oh my God, like we don't understand how you have so many different bacterial and viruses all at one time. And they always knew, with teachers, if you're not there and you're out sick, then you are sick. You cannot get up. This makes a huge difference because now we are forced to care for ourselves, and parents are seeing the benefits of this because now we are able to do in-person mask-free instruction where the public schools are still shut down and doing virtual. So this has become a valuable tool, and I have not been sick. So this has been a very valuable tool for us.
Incredible to hear. Really moving. I'm glad we're able to help end sickness in general. You know, getting sick in general is not fun.
I definitely agree. I hope that, you know, there's some societal norms that just change and, you know, create a better world. I appreciate everyone sharing, you know, just your experience, even with Fever Free. You know, here at Community Boost, we don't typically, you know, highlight such specific technology in a lot of our content, but, you know, as we, you know, met the team and heard some of our partners who were interested in it, and we just wanted to talk about it because, you know, everyone's at their different, I guess, stage of reopening and or not shutting down or just building these processes. But as we talked about today, that this isn't really going anywhere. And I think there's a lot of value in what technologies like Fever Free and what Fever Free can do to really just streamline success and streamline the ability to monitor, so we can ultimately again focus on the mission of you three all have very different missions, but it's really cool to see how this technology has helped you, you know, continue to live into that. So I really appreciate everyone's time today and your experiences. And then I know that we have a link that we'll be sending out to all attendees as well. Or Jessa, do you want to share that? Like, what's the best way to learn more about Fever Free as well?
Yeah, thank you again for having us here today. It's been really amazing to share about the journey and more about the technology. Really, we truly do want to help the most amount of people right now in the quickest amount of time and be there for our community now more than ever. time to come together. So we would love to help as much as possible, even if it is just information sharing, not even with our technology. But we would love to also help in other ways. And I will definitely share the link in the chat here, and you can come to feverfree.ai. And if you're a nonprofit, first responder, in the educational space, we heavily discount our product. We want to make sure we know how critical it is that you guys are out there keeping our, not only our economy, but just us as a society together. So we appreciate everything you guys do.
Excellent. Well, until next time, thank you for everyone who joined us today, and really appreciate all the panelists' insights, and have a great weekend, everyone.